Alexa TV presents in 3, 2, 1. Dateline Schools with your host, Terry Harrington.
All this week on Dateline Schools, I had the privilege of visiting the St. Clair County Health Department and learning how we can do a better job and even a greater job of helping keep this a healthy community. And tell us all about it, my special guest is the health director here at the department, Dr. Annette Mercatante. And obviously, it's easy for you to be reactive to when things happen, but how do you keep ahead of the game and stay that step ahead?
Data, surveillance. So there's a science called epidemiology, which is at the core of public health. Epidemiology is the study of disease within a community or a population. And a lot of it's statistical, a lot of it is accurate and appropriate record keeping, reviewing data. I think a big part of keeping a community healthy is not backtracking, and it's a good time for me to talk about immunizations, which has had a huge impact on the health of our community, and yet we're seeing kind of a backpedaling now of the community not really believing in it or seeing the value of it, and that's a risk when things don't happen in public health, which is the purpose of public health, is we prevent problems. So when those things don't happen, we lose our fear of them. And so a big part of our job is kind of keeping that memory there of this is what could happen without these great medical advances.
And one of the ways you gather data is doing a community health assessment, which the county is now doing. Tell us about that.
Right. So community health assessment should be a core component of our work. We've done one traditionally every 5 years, but the last one we did was in 2010. They're expensive if done correctly because it requires data collection in a unbiased, randomized way. And so this year we got a late start, but we're doing I think a couple extra steps to it, which are gonna make the information much more robust and valuable for all of our stakeholders. And more importantly, we're doing it in conjunction with our community stakeholders, our hospitals and our community groups. And our resources that all need this data to kind of understand where to go next. But instead of us doing it separately, we're moving towards doing it together, collectively. I think that's really an exciting part of this.
We'll be back with more tomorrow. For Dateline Schools, I'm Terry Harrington.